So as Tracy mentioned, we're back here for round two of this talk and a follow-up with some additional data that we didn't have when we spoke to you last time. So I think last time I did it on my own, but Chandy is joining me. So we'll be going sort of back and forth through the presentation as well. So when we spoke to you last time, we had just sort of done our first analyses on the survey results of the impacts of mental health related to COVID here in New Brunswick. And since then, we've got some additional data, which we've combined and to be able to look at a larger sample of New Brunswickers and how mental health has fared over the pandemic and what things might be contributing to increases in negative aspects of mental health. So I will just give you guys a bit of an introduction to this work. So this survey was actually a nationwide online survey that was conducted and funded through Health Canada and conducted in partnership between Mental Health Research Canada and Polera Strategic Insights. And so Polera is a research company, and so they've been executing the survey over the pandemic. They had planned, I think it was 12 or 13 polls. And so the goal was to get a sense of the mental health of Canadians over the pandemic, and so why they're consistently conducting them. Each of the surveys has very similar questions, although depending on when the survey was conducted, certain aspects were introduced. For example, more recently, aspects of vaccinations were introduced, which they weren't in the original surveys and the one we presented to you previously. So this time we've got some vaccination type of information to talk about. And so as part of that national surveying, New Brunswick was one of the provinces that were included, but the representation from New Brunswick wasn't substantial enough to be able to conduct an analysis on. And so the ability to oversample was provided to us. And so we did that, and that was the results that we presented to you previously. And so those were the survey results from August 2020. And so the original polls include about 100 New Brunswickers, whereas with this oversampling, that included over 500 New Brunswickers in each of the samples. And so at IRDT, we use some of our funding to obtain these oversamples at 3 time points over the pandemic. So the first one being in August 2020. So those were the results that we had shared with you previously. And since being with you, we've obtained additional data sets that were oversampling from April 2021 and October, most recently October 2021. So in each of these oversamples represented about 500 New Brunswickers. So in all, we have about 1,500 respondents. In order to respond to the survey, one had to be over the age of 18 years. And so the survey includes a lot of different aspects of mental health and characteristics in which we can look at in relation to mental health of New Brunswickers. And so for the purposes of this presentation, we're talking about some analyses that we've done on these data sets. So the first is that we're focusing today is really to explore impacts of social factors, economic factors, and recreational activities and how they're impacting mental health as reported. And we also wanted to then explore how these factors are contributing to increases in anxiety and increases in depression, as well as in needs to access mental health supports. And as I mentioned in the more recent survey, there were questions that get at vaccine mandates. And so we thought it would be interesting to include those here. But for the purposes of that last bullet, number 4, it's only for the most recent poll, given the context in which those were implemented. And so for the analysis that we conducted previously, we had just qualitative types of analyses. Today, we're presenting some regression analyses that we've conducted in order to identify what are independent predictors of particular outcomes that I've mentioned. So now I'll switch it over to Chandy, and she's going to give you some insights into these factors. And Chandy, you just let me know when you want me to change slides.
Yeah, will do. Thanks. So the impact of social factors was similar across all 3 polls. But if we look at the breakdown by our subgroups, for the factors listed on this slide, females, young adults, so those in the 18 to 39 year age group, and those with previous mental health conditions reported that they were most negatively impacted by social isolation. Next slide, please. Overall, economic factors have had a negative impact on the mental health of New Brunswickers. Most impacted in this case were young adults and those with previous mental health conditions, with 2 in 5 of individuals in these groups reporting that they were negatively impacted by the possibility of not being able to pay household bills. Next slide. Recreational activities like going outside and recreational reading continue to have more of a positive impact on mental health. However, next slide. Activities like following the daily news about the COVID pandemic has more of a negative impact on mental health based on all 3 polls. About 1 in 6 New Brunswickers report a very negative impact. Specifically, females and those with previous mental health conditions report the daily news has a more negative impact on their mental health. Next slide.
All right. In extending the work that we did previously, we decided to also look at some pathologies, I guess, of mental health. So the factors that Chandy had described to you in the previous slides were asking individuals to report to what extent these factors were contributing to their mental health, both positively and negatively. But one thing we wanted to also do is to try to understand is how those factors are contributing to anxiety levels or depression levels. You may have negative impacts on mental health. However, those negative impacts may not resolve in a pathology like a diagnosis of anxiety or depression. So we wanted to take that a bit of a step further. And so this is what we're showing you here. So this graph is demonstrating the levels of anxiety, reported anxiety from a scale of 1 to 10. Pre-pandemic is in the gray, and then in the red, we have the during the pandemic. And so as I mentioned, this is data that we pooled across all 3 surveys. So it represents 1,500 individuals. So as you can see, overall, people who reported 0 means no anxiety level, and people who reported 10 is the highest anxiety level. So when you compare the gray bars to the red bars, you can see quite a shift in people's reported anxiety levels. There's a definite shift in the distribution towards a higher anxiety level. Pre-pandemic, we're seeing high values of people reporting their anxiety level as a 2 or 3 or a 5, for example. Whereas during the pandemic, people are more likely to report numbers in the higher range, such as 6, 7, and 8, for example. And so looking at this, we can see that that pandemic has resulted in increases in anxiety in a substantial number of individuals who responded. Oops. Oops. So now when we look at depression, we see that levels of depression overall are quite lower in this population, as a large proportion of individuals report a 0 level of depression, both pre-pandemic, but also during the pandemic throughout the surveys. The distribution shift in the depression isn't as evident as you saw in the anxiety, but we are noticing that as you move towards the right-hand side of the graph with the higher values, that you see that the red bars are higher than the gray bars. Whereas you look at to the lower end of the scale, closer to 0 and 1, the gray bars are higher than the red bars. So that's indicating to us that, post-pandemic or during the pandemic, that depression levels are increasing, and at those individuals reporting very high levels of anxiety or depression, are greater in number as well. When we look at the difference of someone who reported their level pre-pandemic as compared to post-pandemic, we looked at the difference. So here, if your difference is greater, then you have more anxiety during the pandemic or more depression during the pandemic than pre-pandemic. If your value is negative, you're actually reporting less depression or less anxiety. So as you can see, not very many people are on the negative end and more people are on the positive end. So this is indicating that more people are reporting increases in both anxiety or increases in depression. Here, the red and the gray bars mean something different. So take a look at the legend. The gray bars here are anxiety levels, and then the red bars are the depression levels. So unlike previous, and so what you can see here is most people are not reporting a change in their depression level. So most people said they were the same level of depression pre and post pandemic. And so that's represented with a large red bar at this point of 0. Similarly, for anxiety, most people aren't reporting a change in their anxiety level. They have a similar anxiety pre and during the pandemic. However, we do see that as we increase in the number, so meaning that people are reporting higher levels during the pandemic than pre-pandemic, that these still represent a large proportion of individuals in the sample, and that as we see higher changes in anxiety and depression in a smaller proportion of people, and that's a good thing and what we would expect to see or want to see, I guess, not expect, we'd hope to see. So now when we take this information a bit further to try to say, okay, so among people who reported higher anxiety during the pandemic than before, what are things that are contributing to that increase in anxiety? And so Chandy showed you some of those contributing factors independently. And so what we decided to do is consider them jointly. And so in a regression model, you can include multiple variables. And what it does is it helps you tease out which of the variables are contributing meaningfully to a specific outcome. And in this slide, the outcome we're interested in predicting is increases in anxiety. So people who reported a change in their number of anxiety and a higher number after the pandemic had begun. And so when we look at individuals who are reporting increases in anxiety, there's certain factors that seem to be predicting that increase in anxiety. Increased anxiety is associated with mental health impacts of catching COVID. The daily news is also having a substantial impact on people's level of anxiety. Inability to pay bills and social isolation were also factors that came out as being predictive of increased anxiety, independent predictors of increased anxiety in this sample. When we consider these things together, economic downturn and the possibility of a family member catching COVID aren't the predominant factors, and in fact are correlated with these other factors. And when we consider them together, it's in fact these other factors that are making that substantial contribution. And so when we look at the increases in depression, we see that there's similar relationships and in which the daily news, the inability to pay household bills or social isolation are contributing to increases in depression as they were contributing to increases in anxiety. The red line on this graph, as you saw in the previous graph as well, indicates an association of 0, so no association. And so when the lines cross that red line, we tend to suggest that that's not having an impact on the outcome that we're interested in exploring. And here it's the increases in depression. So whereas increases in anxiety, we saw that catching COVID was an important predictor. It's less important when we're thinking about increases in depression. Right, so anxiety, catching COVID seems to be contributing more to people's levels or changes in anxiety, whereas catching COVID isn't having as profoundly as an impact on their levels or changes in depression. So in addition to levels of anxiety and depression, we also wanted to explore how accessing or needing to access mental health services or mental health support was being related to these mental health factors as well. So one of the questions in the survey asked individuals whether they needed mental health support, and if they needed mental health support, if they accessed it. So good news, almost 70% of people who responded to the survey did not need mental health support. So that's great. But we do have about 20% of people who did need mental health support and accessed it. However, there's about 12% of individuals who needed mental health support but did not access mental health support. And so these are individuals who have unmet healthcare need or mental health care needs. And so we wanted to look at how the factors that Chandy showed you, how they contribute to needing to access mental health services. And this is what we're showing here. So the blue bar is individuals who responded yes, so they access mental health support. And the red bars are people who needed mental health support but did not access it. So overall, the relationships are quite similar in that things that increase people's likelihood of needing or accessing support are similar between the groups, although there are some differences which are interesting in themselves. So what we can see is that the need to access mental health support, whether you did or not, is very highly driven by social isolation. And there's stronger effects in all of the factors for those people who needed support but did not access it. When we look at the factor for inability to pay bills, that was another one that came out as an important contributor to mental health amongst people who needed help, support, but did not access it. In the individuals who responded that they needed support and access it, inability to pay bills was marginally important, although it's showing a similar relationship as well. What we showed in the depression and anxiety was that the daily news, as well as catching COVID, seemed to be predictors of increases or changes in anxiety and depression, whereas they don't seem to be predictors here when we're examining need or predictors of change, needing to access mental health support. So in all, these models are really showing us that social isolation is an important factor related to mental health of New Brunswickers for those individuals who responded to this survey. And among the economic factors, the inability to pay bills was consistently also demonstrated to be an important predictor. All right, so I'm going to switch things back to Chandy so she can let you know about the vaccine results that we obtained.
Thanks. As Sandra mentioned earlier, the question related to the vaccine mandate was asked only in poll 9, which was done in October 2021. Overall, the vaccine mandate has had a positive effect on or impact on mental health. But if we look at our subgroups, more young adults, families, and those with previous mental health conditions report a negative impact. Next slide. Of the 37 people who said they did not receive a vaccine, a majority said they will not be getting vaccinated at all. It's hard to say anything conclusive based on the small sample size, but the results possibly demonstrate vaccine hesitancy among those who aren't yet vaccinated. Next slide.
That gave you some insights into some of the more recent results that we've gleaned from the survey that we obtained. And so overall, we really have demonstrated that various mental health impacts related to social aspects, economic factors, or recreation have really had a similar impact over the course of the pandemic. We did not observe any striking differences over time or trends as we thought we may have been able to observe. We do see that the social and economic factors are having or have had a substantial negative impact on mental health. And some of these factors more so than others, for example, social isolation having a predominant impact on our population. Recreational factors or activities had more positive than negative impacts on mental health. So these were interesting to be able to pull out some positive activities that may be able to contribute to people's mental health, such as going outside or reading. Aspects related to the negative aspects of recreational activities like daily news or social media had negative impacts on mental health and substantial negative impacts when we look at our further work as well. We observed greater increases in anxiety than in depression levels, and we have a substantial number of individuals who are reporting unmet mental health support needs. We identified that social isolation and the inability to pay household bills were independent predictors of all three mental health impacts that were outcomes that we examined. So we examined increases in anxiety, increases in depression, and needing to access mental health services. The daily news and the possibility of catching COVID were also independent predictors when we examined changes in anxiety and changes in depression. And so overall, we found that vaccine mandates had a more positive impact on mental health, though there were some differences across population subgroups that we observed. And of those not yet vaccinated, it appears, based on those who responded to the survey at least, the majority will not get the vaccine. So just to finish off with some next steps, we're currently writing this workup for a report that we're planning to post on our website. We're also just about to finish up some analyses using these data in which we have been able to identify many different characteristics that get at social determinants of mental health. And so we're doing a social determinant of mental health analysis, looking at screening tools for anxiety and depression, in addition to aspects of functional impairments and levels of resiliency, and how these different determinants relate to these outcomes, and which of the determinants may be more predictive of negative outcomes in our population. We're also using these data to collaborate with Nova Scotia and New PEI. They both did an oversampling as well in a recent poll, and so we're combining the data to look at mental health of Maritimers. Actually, Channy and I just got off the call with them before this meeting, in which we're really hoping to hone in and focus in on some of these reasons for unmet healthcare, mental health care needs. And so we're pooling the data, and we have patient partner representatives from all three provinces, which has been a very valuable experience as well in developing the research. So I want to thank you for taking the time to listen to us, and I hope you enjoyed the results and found them insightful, and we welcome any questions at all. And I just want to acknowledge the rest of our research team, Madeline Gormanda Saul, Kelsey Evans, and Pablo Maya, who are not here with us today.